My name is Renee, and I am in speech therapy. The purpose of this training video is to review how you will be completing a dysphagia screening on one of your patients. This dysphagia screening must be done with all stroke and TIA patients before any oral nutrition, hydration, or medication is given to them. It is a requirement of Joint Commission for all stroke certified hospitals for patient safety. It's a standard of care established by them so that we can be sure that our patients are not aspirating. Watching this particular video is one of several steps that you will need to take in order to be checked off as competent to complete this dysphagia screening. So check with a clinical educator at your site as to what other requirements are needed to be checked off as competent. Before looking at this dysphagia screening form, what we're going to do is we're going to look at some images of some normal and a few abnormal swallows so that you have a better sense of what you're looking at when you're working with your patient and why it is important for you to get a feel for abnormality in your patient's swallowing. These images that we're going to be looking at are from modified barium swallow studies, which speech pathology will be doing with some of your patients who need this type of evaluation. Otherwise, a bedside swallowing evaluation may be all that is needed in some cases. All right, let's start the video. What we're going to be looking at initially are normal swallows. This particular patient is facing left. You can see his oral cavity and his pharynx. These first swallows are thin liquid swallows. Real normal, very fast. This is a swallow of pureed food. A little bit thicker, looks a little bit different. Not a lot of residue. Here is a swallow of a soft solid where the patient is masticating the bolus, and you can see that it's a very smooth, easy, clean motion that happens as this person swallows this food. Here are some examples of abnormal swallows. This is a patient who is orally manipulating the bolus. At bedside, they may look like they're swallowing. As you're watching their throat, their larynx is moving a little bit, but he's actually holding the bolus in his mouth. Here is an example of a slow, delayed swallow reflex. The food spills toward and actually above over the airway right here as it falls onto the aryepiglottic folds, and that presents an aspiration risk. That's one of the things that we kind of try to watch for as we look at your patients. Here's a patient who's masticating a bolus. Again, a delayed swallow, decent residue in what's called the vallecula and the piriform sinuses. Here's the same swallow again. All right, that patient may need to swallow twice. Let's pause the video here. What I'd like for you to notice is the patient has already swallowed what we will see is a liquid bolus. He has a new bolus in his mouth. There's residue, severe residue. The dark at the lower right corner of the video is residue in the piriform sinuses. That residue shouldn't be there. It actually needed to have cleared the pharynx during the swallow. But as you'll see, as we go along, that residue is going to create problems for this patient. So let's go ahead and look at this swallow. This gentleman, a delayed swallow, and look at all the residue at the top and the bottom of that highlighted area in the valleculae and the piriforms. That presents a very big aspiration risk, and lots of times patients don't even know that the food is there. Here's another abnormal swallow. Let's pause. All right, as you can see in that swallow, the first swallow of that bolus did not clear any of the food through the pharynx into the esophagus. The second swallow resulted in severe residue in the pharynx, both in the valleculae and the piriform sinuses. It's an overall weak swallow, and while it doesn't show up well on this image, there's a slight, at kind of a 7:30 position with all of that residue, there's a line that is protruding down away from the large mass of barium. And what that is, even though we can't see it well, it's barium that's being aspirated into the airway. So this patient's swallow is severely impaired. And if we were able to see this video live, you'll notice, you would see at the end of this swallow that this patient does not cough. He's lacking a cough reflex, which also is risky. That's part of the reason why we're looking for a wet vocal quality as we work with these patients, in that they may not cough, but they may be wet and gurgly as they speak to you. So we'll talk more about that later as we go along and review the dysphagia screening. Let's go ahead and start the video. You can see that aspirated material a little bit better down in the lower left-hand corner. All right, here's a patient who needs to swallow a couple of times to clear or reduce at least a little bit of that residue in his pharynx. And we'll stop the video here. Okay, let's review how to complete the dysphagia screening form. It's pretty self-explanatory. It's very simple in that there's a series of 11 yes/no questions. And as you go along, if you answer yes to a question, you simply move on to the next question until you're done with all 11 questions. And then at that point, if your responses have all been yes, then the patient has passed the screening. And you can go ahead and order the patient's diet order per the physician's order. However, if you ever need to respond no to a question, you move to the right-hand side where it talks about that you need to stop the screening, call the physician for additional instructions or orders regarding medications that can be taken in a non-oral route, keeping the patient NPO, and consulting speech therapy for a full bedside swallow evaluation. The form is divided into 4 major sections with a few of sentences of general instruction at the top of the form and a few at the bottom, and we'll review those. At the top are some general instructions, and let's just briefly take a look at those. It says here, complete prior to any oral intake, including oral meds, and that is just a reminder to you that according to Joint Commission standards, this screening is to be done before any oral intake is provided to the patient. And then just some common sense things that you all would be doing anyway. Make sure the patient is sitting upright, at least at a 70-degree hip flexion, possibly 90 degrees if that's possible. And try to make sure that the patient is alert. If there are any dentures or partials or glasses or hearing aids that are available, it would be great for the patient to have those in so that that patient is able to understand your instructions. Also, if a patient is non-English speaking, then it would be good to have an interpreter present so that the patient can understand what you're doing and can follow instructions. All right, let's move on to the first of the 4 major sections of this form. The first section really focuses on the past medical history. We're talking about the fact that we need to look at what the patient's history was about before this current hospital visit. Whatever brought the patient to the hospital on this particular day is not what we're considering. We need to consider yesterday or a week ago, what did their history include? Did it include any swallowing problems or any nutrition issues? Did the patient have any previous neck surgeries or any previous strokes that caused swallowing problems? Did the patient have a feeding tube placed? And if so, for what reasons? So it would be you trying to get as much information as you can from the patient or family or any previous medical records in our system, from a nursing home staff member, or from any records that the nursing home may have sent with the patient. What was the patient's diet level prior to admission? Was the patient on ground meat, thickened liquids, pureed food, thin liquids, supplements, those kinds of things? If someone is available to communicate to you, if the patient isn't able to, was there any coughing or any concerns during meals? So the question is worded, was the patient's history free of any problems? If you respond yes to this question, indicating that the patient had no swallowing difficulty, then you would simply move on to the next section. If there is no information available on your patient, then feel free to use your clinical judgment as to whether or not you believe you should proceed with the screening. You may want to take a few minutes to handwrite on the form your justification for that. You may want to write in that section, not applicable, no information available, or whatever you want to document to justify your decision making as you proceed through this screening. Let's move on to the second of the 4 major sections. Really, the basic point of this section is the patient alert enough to be able to participate in this process? If the patient needs to be continually stimulated to remain awake enough to participate, then it seems like it would be wise not to proceed, or that it's fair to say that he or she would not be awake enough to be able to take a meal in, or even if you had multiple medications for the patient to swallow, that he or she may not be able to tolerate that. If the patient's level of alertness is poor and you fail the patient on this screening today, it is possible that with a stroke in a TIA patient that their level of alertness tomorrow, the next day, could be greatly improved. And we would encourage you to repeat that screening one more time. If it's in a situation where speech pathology is not available to complete a bedside swallow evaluation right away, then it may be helpful for you to repeat the screening one more time with the patient being more alert, because certainly that patient then may pass the screening. Let's move on to the third of the 4 major sections. And what it's asking you to do, it's asking you to look for 3 things about the patient. It's looking for you, or it's asking you to look for the patient's vocal quality. Is it clear or is it gurgly? If it's clear, you would respond yes. Is the patient's vocal quality clear? Yes, and you would move on. Is the patient able to manage his or her own secretions? If in fact the patient is able to do that, if they are not gurgling or coughing or clearing their throat in a continual way, then you would say sure. And if you did not feel a need to suction the patient's oral cavity or their oropharyngeal area, then you would respond yes, they're managing their secretions, and you would move forward. Or the next question is, does the patient have clear, intelligible speech? If he or she does, you would respond yes and move on to the next section. In this particular question, use your own judgment regarding the patient and his or her oromotor skills. The patient may not be verbal, and the patient may have a history of aphasia and not talking, not communicating. The patient may have dementia. And so you may need to write on this form, not applicable, patient nonverbal. So go ahead and use your judgment there. If the patient's speech is mildly slurred and he's managing his own secretions, then you could certainly make a note of that and you could proceed with the screening. But you may want to make a note there of mild dysarthria. The speech would be intelligible, but it may not be 100% clear. That wouldn't indicate that you would necessarily need to fail the patient based upon that finding, though. All right, the fourth of the 4 major sections is where you actually start to feed the patient and watch to see if he or she swallows without the following 4 things. You want to see if they swallow without a wet, gurgly voice being demonstrated after the swallow. You need to make sure that they swallow without coughing. The third thing is that they swallow without pocketing food on either side of their face. If they have weakness on one side of their face from a stroke, the chances of pocketing food or liquid on that particular weak side is increased, of course. And we wouldn't want that patient to be pocketing the food and then to recline after a meal and have that food slip into their airway. The fourth thing would be just watching for food or liquid coming out of the front of their mouth and down their chin. That also would be a reason to have this person fail the swallowing screening, because it would obviously indicate poor bolus management, and if their bolus management is that poor, then their risk for aspiration would be increased and they need a full evaluation by speech pathology. The food that you use in this section, you would begin with a half to a teaspoon of applesauce or pudding. You would just provide it to the patient over 3 trials. And I would encourage you to, at some point, if the patient is able to feed himself or herself, to provide the food to the patient and ask the patient to do it himself or herself, so that you can kind of see their skill level on that, while you're also watching to see if they swallow without any of the 4 indicators that we just talked about. The next thing that you would do is you would provide a teaspoon of water. The reason for starting with a teaspoon of water is if a patient is not going to tolerate a thin liquid swallow from a cup, we don't want them to aspirate a large amount of water, and so we would just start with a teaspoon. If they're able to handle a teaspoon of water, then we would recommend that you proceed to cup drinks of water. And again, with the patient, we would do 3 trials of a cup drink of water, and we would ask the patient, if possible, to hold the cup himself and to let himself drink from the cup, so that you can watch for the 4 indicators that were discussed at the beginning of this section. The last food that you want to trial with this patient is, it says on your form, crackers. I would recommend graham crackers because they have a little bit more substance to them. Gives you a little bit of a better idea as to how the patient can handle something that's a little bit more solid than a saltine cracker, something that is a little dry and crumbly and a little challenging anyway. Provide a bite to the patient, make sure they can handle it. If they can, then you can take the cracker into your hand and then watch him feed himself. The reason we're talking about having the patient try to do some of the things himself or herself is, first, to see if the patient impulsively gulps or stuffs his mouth full of food. You need to try to see that during the screening, because if we're going to be bringing trays of food into this patient and we're going to be putting a tray in front of him, if he is quickly filling his mouth impulsively, then we would not want him to be eating meals without supervision, and we probably wouldn't want him eating meals until a full evaluation can be completed and recommendations can be made and the family can be trained and patient care assistants can be trained as well. Also, the last part of this section is, does the patient have endurance and motivation to eat? And again, that's just a personal clinical judgment call that you would make. Do you feel that this patient would have some oral intake safely if we were to provide meals to this patient? All right, we're down to the bottom of the form. And this is where there's just the place where you would sign, date, and write the time of the completion of this screening. If the patient has passed the screening, be sure to order a diet for that patient according to the physician's orders. If the patient fails the screening overall, but passes the administration of the pudding and the applesauce, you may want to discuss with the physician, are there any critical medications that need to be provided to this patient before a complete swallowing evaluation can be done? For example, overnight, are there blood pressure medications that must be given orally that could be provided, perhaps whole or crushed in applesauce or pudding, to this patient until the next morning when speech pathology is available to see this patient? What you would want to do is write the patient's identifying information in the section in the lower right-hand corner of the form, or produce or use a sticker, a patient sticker from the patient's chart. Be sure that this form is completed and stored in the patient's medical record according to your site's policies. All right, that's it. If you have any questions about completing this screening, be sure to talk with a nurse who is experienced in completing this, or you are also welcome to contact speech pathology, and that number is readily available through the operator or through the staff and unit coordinators at your facility. Thank you.